Ladies and gentlemen, let's all welcome our moderator for the day, Dr. Daniela Monene, the Head of Consulting Africa Health Business.
Good morning. Your Excellency, Professor Anyang' Nyong'o, Governor, Kisumu County, Your Excellency, First Lady, Kisumu County, Mrs. Dorothy Nyong'o, distinguished guests, ladies and gentlemen, it's my pleasure to welcome you to this 7th edition of Africa Health Business Symposium. And we're so glad to have you here for an exciting discussion on men's health. The attention accorded to men's health globally and in Africa is not sufficient. There is a 4-year gap in life expectancy between men and women in sub-Saharan Africa, excluding the high-income countries. And this gap is in favor of women and is attributed to, among other factors, the poor health status of men. Reducing the burden of morbidity and mortality in men is important for thriving families, communities, and countries. Our health systems in Africa must therefore focus on the health needs of both genders, at the same time adjust to the differences between them. The attention to men's health will be particularly important in tackling the global epidemic of non-communicable diseases, which are likely to affect more men than women and to affect men at a younger age on our continent. Africa Health Business has therefore chosen to put a spotlight on men's health in Africa, as we believe that more needs to be done to advance men's health on the continent. Our event today is a highly interactive full-day hybrid event. I welcome you all in this room and I welcome those joining us online. We have a number of people joining us online and we have several countries represented from across the world. We have with us today eminent health experts, business leaders, development partners, and representatives of governments to discuss, share information, and provide lessons on key areas affecting men's health in Africa. I wish to recognize our event partners. These 15 institutions have made it possible for us to gather here today. Thank you. I also wish to take you through the program for today. We shall have a session after this on preventive and promotive health. We shall then follow it up with a session on non-communicable diseases. Thereafter, we shall talk about cancers that affect men in Africa. And we shall conclude with a session on sexual and reproductive health, aptly named gynecology, but note the spelling, it's G-U-Y, gynecology. I now wish to welcome on stage the Executive Chairman of Africa Health Business, Dr. Amit Thacker, to give his welcoming address.
Good morning, everyone. Honorable Anyang' Nyong'o, all delegates, distinguished ladies and gentlemen, event partners, good morning. You know, I want to thank you actually for spending time with us this morning. I didn't know, and we didn't know how many people will heed to the call of men's health. When we did women's health, the event itself brought so much attention, and you will see for the rest of the day how much attention, how much funding, and how much involvement is given to women's health, and rightly so. But then we don't want the boys and the men to be left behind. And we thought it was important for us to have this gathering to enable us talk about men's health in order to improve the health systems. On the margins of the 77th UN General Assembly in September, we talked and discussed about Africa. We talked about health, we talked about the growth drivers, and we aptly put it as unstoppable Africa, as you can see on the screen. Africa is unstoppable. And the success of Africa is actually unstoppable. And after the pandemic, it was clear to us that if there is one continent that is going to be the focus of the world, it's going to be Africa. And many of you here today are investors, partners, and deeply rooted and dedicated to what's happening in Africa. Why Africa? The United Nations released a report on Unstoppable Africa. And the bounce back for Africa by investors is also very clear. As you can see on the screen, there are some important factors that came up on the Africa discussion. So did you know that the entire market for Africa is 2.5 trillion? That's the market opportunity that we have. That covers all the sectors. And it is rising rapidly, especially in the last 3 years. Let me go specifically to healthcare because that's where we are. And when we see opportunities in healthcare, it's going to improve health for women, but also for men. And you will see today where we need to invest specifically to improve men's health. We will today also in the 4 sessions talk about the biggest gaps in looking after men so that we have an optimal health for men. We all know that life expectancy has increased over 10 years for everyone. We also know that we are significantly investing both in public and private sector. But Africa's healthcare sector value by 2030, that, ladies and gentlemen, is only 8 years away, is going to be a $265 billion market. And did you know, according to the investment analysis, it's going to be the second in the world in 2030, just after United States, that will command 21% of the healthcare market, 14% will be resting with Africa. All this came through the realization during the pandemic because one small virus made Africa wake up to feel that we need to start looking in Africa, by Africa, for Africa. The impact of relying on self-sufficiency, local manufacturing is going to be the main fulcrum. By 2050, 1 in every 4 persons will be living in Africa. We have a youthful, vibrant population that will be critical for life sciences and healthcare across the world. No wonder in many of your countries, we are talking about training and we're talking about collaboration with Europe, with the US, with the rest of the world when it comes to human resources for health. Who do you think will be producing the right kind of healthcare staff and professionals for the rest of the world to ensure they tackle diseases? I will very quickly talk about the growth drivers that you see in front. The financing models, as you will hear even later today, include financial partners like African Development Bank, many financial institutions and private equity that are funding healthcare in Africa rapidly. The bold partnerships that exist, you can see the public-private partnership that Professor Nyang and we spoke about earlier, in making sure that the PPP models around Africa start working and making an impact. The other partnerships also include development partners. Let's not forget the role of USAID. Let's not also forget organizations like the Bill and Melinda Gates Foundation. But the other very interesting partnerships that's rapidly rising is the domestic funding. Internal resources in Africa are making Africa become more self-reliant. There is an institution called ACFTA, the Africa Free Continental Trade Area Agreement. That is going to be a major game changer in the way many of us in the health investment are going to look at our businesses, whether we are headquartered in Dubai, whether we are headquartered in Washington, DC, or we are headquartered, say, in Mumbai. When you will now come with your supplies, whether it's pharma, whether it's medtech, whether it's training, you will now be able to have free movement of people, goods, and services. This will enable you to tackle the 1.3 billion market in a more effective way than setting up your business for a country that may have only 50 million people. So this continental free trade agreement will improve the ease of doing business and will improve the engagement with partners across Africa. We have talked about the full participation of women, and we at Africa Health Business are dedicated and committed to include women in ensuring that their health needs are not left behind. We have started the Coalition for Women's Health in Africa, and those of you who are interested, please talk to us. You can join us. We had a launch in Addis Ababa, and now we're having a launch of the coalition on Monday in Johannesburg. In pursuit of climate justice, you all heard our President, His Excellency William Ruto, talking about climate change at COP27 in Sharm el-Sheikh. The time is now in Africa not about planting trees, it's about growing trees. And looking after the growth of our environment will have positive effects on healthcare. If you look at fossil fuels and talking about renewable energy, Africa is the most well-positioned continent to reduce the use of fossil fuels. If you look at wind, solar, geothermal, hydro, we have the capacity to move away from fossil fuel use to alternative sources of renewable energy. At the UN, when this topic was discussed, 6 million new jobs in Africa were identified under renewable energy. These are meaningful jobs. And many of us are looking at green hospitals across. And those of you who are encouraging this movement, I really would like you to see this across the continent as an important impact. A lot of the Africa's growth and talent are in the informal sector. On the point that I'm talking about is the emergence of the Africa's creative and cultural industry. If you look at art, music, entertainment, and films, it's very interesting to see how Africa is well positioned to leverage on a multi-trillion-dollar industry. I would really like to appreciate here the parents of a star that we're all proud of, who's made it into Hollywood from our own country. Lupita Nyong'o, as you all know, is somebody that we admire. Daniela has schooled with her and has had a chance to spend some time in class, but I really want to appreciate, acknowledge, and recognize the parents of Lupita Nyong'o, Mr. and Mrs. Anya Nyong'o, who are here with us. Let's give them an applause. Please take our felicitations and recognition. It's stars like those that inspire the youth across the entire continent to go ahead, because Africa is unstoppable, and Lupita was unstoppable. The other 2 points I want to mention before I call on our chief guest is the role of technology, innovation, and adoption. 600 tech hubs were formed within the last 5 years in Africa. The 4 countries that become a shining star include Nigeria, Egypt, Kenya, and South Africa. 3,500 new startups within the 3 years. It's amazing what's going on in the tech and the digital health space. 70% of those companies were formed in the last 3 years. The pandemic created a kickstart about digital health. Ladies and gentlemen, digital health is non-negotiable. It's coming. It's going to be there. Whether you want to do e-pharmacy, whether you want to do e-consultation, whether it's about e-health, it's the next level of ensuring we break the geographical barrier in Africa so we reach more people than we ever have in the past. And it was mentioned, in the UNGA meeting. Finally, as I end, did you know that the 60 uncultivated arable land of the world is in Africa? If we did address that, Africa can feed the world. These are some of the key growth drivers that we are sitting on our continent. I am really delighted to let you know that Africa really is the continent of hope, and Africa is not rising. Ladies and gentlemen, Africa has risen. Thank you very much. All this will lead to ensuring that the growth patterns impact men's health that we're going to discuss, more funding, more partnerships. With this, ladies and gentlemen, it is my honor and pleasure to call on stage our chief guest, who was, as you know, a former Minister for Health, where he and I engage very deeply on public-private partnership. Sustainable differences were made in NHIF and KEMSA, which we are still building on. He now is a lead in governors when we talk about county champions and counties that are leading from the front. In fact, his county was also one of the pilot counties of UHC, as you all know. Those of you who are traveling from outside, we had a pilot study for 4 counties, and Kisumu was selected as one of them. And he's not afraid of innovation and taking health to the next level. Please join me in welcoming Honorable Professor Anyang' Nyong'o on stage to address us.
Thank you very much, Amit. Thank you very much, the organizers of this very important conference this week at the Trademark Hotel. Thank you very much, the First Lady who escorted me here and is a participant in this conference. Without her, I wouldn't be here today. She would have commanded something else. Well, ladies and gentlemen, I stand here and bring you greetings from the people of Kisumu, and I'm here with my Minister for Health, Dr. Greg Ganda, who will stay for the whole conference, and my wife will be here for the whole conference. But unfortunately, very unfortunately, I have to go to the Council of Governors because I'm chair to a very important committee, the Committee for Urban Affairs and Land. And you know, urban affairs are extremely important in this country today. Africa is fast urbanizing, and by the year 2050, more than 50% of Africans will live in urban areas. Kenya is no exception. So I'm really happy to be here this morning because this is a topic I hold dearly, having been at the center of discourse on men's health and health in general. And I think that having this discussion at this point in time is not only timely, but very relevant. I have seen the elaborate presentations that have been prepared today on men's health from the program. And we today just give you my own personal reflections on this matter. This agenda has been evolving, and I'm quite impressed that it's slowly weaving itself onto the table where all matters of health are being discussed. That is the issue of men's health. Well, I know that the theme of this conference will revolve around the private sector. My reflections today will go towards innovative ideas that would work in both the public and private sectors. Having been a minister in government for medical services, I interacted very closely with both the private and public sector. And my conviction was after that both must work together in the area of healthcare, not only in Kenya, but I think elsewhere as well. Statistics globally have shown that men are generally less healthy than women, and on average are more likely to die about 60 years earlier than females, especially men between the ages of 25 and 65. So if you are sitting here before those ages, within those ages, I think you must be paying attention to what is happening to your health. If you go beyond 65 like myself, then you can clap and say, I defeated. Coming back home, life expectancy of men is about 64 years. Well, that of women is about 69 years. I think it was mentioned earlier this morning. Further, data from the World Bank put suicide mortality rates as of 2021 at 6.1 people in every 100,000 people, with men being at the highest risk category of 9.1 men in every 100,000 people. We may ask ourselves, why are men at risk to commit suicide more than women? Shakespeare would say they are a weaker sex. For a long time, men's health has been a taboo topic. They have been taught since childhood to guard up feelings because of fear of repercussions in a society that has taught men not to cry, not to show their emotions, or even be vulnerable to being seen as being weak. Nobody ever talks of macho women, but every man must show a little bit of machismo from time to time, even when it injures their health. Machismo is a very valuable commodity among men, and they guard it jealously. Nonetheless, I'm glad that the tide of change has begun, and now we are beginning to have conversations around men's health in a conference like this, with men and women sitting down together and opening up their feelings and ideas to each other. Traditionally, most of the priority health programs that are designed with the women in mind and men as an addendum. Most men by nature are impatient and introverted when facing medical challenges. When a man has a health appointment at 4 and turns up at 4 and the doctor is still busy doing other things up to 4:45, most likely he will leave and leave a note to the doctor that I'll call you later. To reach out to more men, we would have to create unconventional medical centers tailored around the needs of men, such as their appreciation for privacy and confidentiality. Please don't think that I'm giving a biographical and autobiographical treatise. This is a general treatise that I'm sure you can all share. We need a front office culture that will acknowledge men's problems with keeping appointments and therefore allow flexible schedules like early or late clinics to accommodate men working shifts or commuting long distances. Men, by the way, like internalizing their problems. Women, on the other hand, very easily externalize their problems. I remember one time I was traveling between Chicago and Madison, Wisconsin, when I was a graduate student there, in a bus. And the woman boarded that bus and came and sat next to me. And after some time, she started crying. So I asked her, I'm sorry, my dear, but what's happening? And she told me a whole story between her and her boyfriend, and that she's expecting, and she called the boyfriend and he's not answering, and he's stopping at the next stop. And she was wondering when I was going to get off the bus with her. I told her, no, I'm going to Madison. I'm not. And finally, she left the bus, me sitting there and looking back at me as if I had all the answers to her problems. That was my experience. I don't know whether you women behave like that. But I think that women on the bus that day frightened me a little, that women easily externalize their problems, particularly to men. One key area of collaboration we can have with the private sector is the establishment of wellness clinics that are male-friendly and male-oriented, with a focus on the health matters that concern men, such as lifestyle diseases and cancer, specifically prostate cancer. I was a candidate for this in 2011. I had prostate cancer, and I went for treatment at the University of California, San Francisco, at a very good Clinic, Helen Diller Comprehensive Cancer Care Center, under the care of Professor Roche, a world-renowned prostate cancer specialist. And when I was away, there were rumors and even articles in the papers that I died in California. Until my friend Dennis Onyango called me that, are you dead or still alive? And then my wife and I discussed this, and we decided that I should write articles in the Standard. I was then a columnist in the Standard. And I wrote a series of articles on prostate cancer. And some men called me and said, please, you have helped us. I've been going to the clinic and I found I had prostate cancer. And many men were happy, but others, when I came back, were not quite convinced. This guy, I think yes, let's wait, it will soon die. But now that I've lasted this long, I hope they learned something. Could it be that men will wish to have access to the entire range of services in a center where they will only meet fellow men? That is food for thought, ladies and gentlemen. Or could it be that men are actually waiting for an app on the phone that tells them to go for annual health tests at their nearest level 4 hospital? I mean, we discover all kinds of apps on the phone. I have not seen one that tells me about when to go for tests and all that. One specifically done with the Kenyan context or the East African context. The private sector, I think, will need to explore establishing such innovative models to cater for men. And the private sector should do it without thinking of profit. This could be a social service that will help the healthcare system delivery systems in our society. Who thought men grooming salons would attract men? I am told male kinyosis are nowadays more profitable than the typical female salons of our days. Women, beware. If you want to make business, you want to make money, start a male kinyosis, don't go to your salons. In such male-focused clinics, men would need to have screening for mental health illness. Men could much more easily access health awareness facilities in social places where they go to, in nightclubs, in football pitches, and places like that. Traditionally, men are not known to speak about their problems, including you men here today. I've spoken about mine, I've known about you, but anyway, mine, since I'd written about it, is no longer secret. It is in the public domain. This worsens their mental health status. Access to screening and subsequent requisite mental health services would be an added benefit. My wife, in their screening programs, meet more women than men. I must give you. Yeah, it is known that Africa Cancer Foundation screens for prostate, cervical, and breast cancer. But if you get the statistics from Africa Cancer Foundation that she has, 3/4 of the people she screened. Do you ever screen men? Yeah, very few. I think I should go to be screened so that others can follow. They would need screening services for non-communicable diseases such as hypertension, diabetes, prostate cancer, among others, which have a higher prevalence among men. Men's sexual and reproductive health would also be an important add-on. Males suffer silently from many reproductive health issues, and many at times do not get the requisite help. They would definitely require skilled expertise in this very delicate area. I was telling my Minister for Health, Dr. Ganda, and my wife that a male who was having some reproductive health system came at a funeral and whispered to me what his problem was. So we whispered to each other and I told him what to do. 2 months later, again at another funeral, he came and whispered to me and told me that's nice, now okay. He whispered to me, you know, I still remember the 2 experiences. He didn't want anybody else to hear, but I think confidentiality was important, so I behaved like a doctor and protected his confidentiality in this communication. Only that years later, I have to tell it to people away from his hearing anyway, but I hope I'm not preaching any medical ethics here. Last but not least, ladies and gentlemen, these centers should address nutritional needs to ensure that their body mass indices are within the normal range, and again, linkage to support services for those who may be out of range. Again, that app, what I was talking about, can talk about these body mass indices and tell people what to do and what it means, rather than going to a doctor to find out what it is. This therapy would be holistic to include diet counseling and provision of food options for a healthy lifestyle. To enhance access even further, a broad range of services can be considered to be provided not only within the confines of the clinic, but even via cooperative engagements with local partners like sports clubs and so on that I've spoken of earlier. However, ladies and gentlemen, let me throw some rather discomforting paragraphs or two. Even with these grand ideas, what can we do with our current health facilities to encourage men to come to hospitals for their needs? Perhaps it is time to start social marketing around men's health. Are we able to start small and consider having a men's clinic in our large health facilities, such as yours at Kenyatta University, teaching Arifa Hospital? You've done very well, actually, over there. Define a package of care for them, put it out there and encourage them to come in. I mean, social marketing has to be very aggressive. You assume that you have a market there you want to penetrate. And you, to begin with, you don't assume that people will listen to you, but you have to aggressively follow them and make it known on a daily basis. I've always given examples in my county on how advertising works and how, if you have a new ideas you want it to work, you have to push it over and over again. I remember in 1963, here in Kenya, I was in Form 2, the Lance High School. And at that point in time, British cars were dominant in the market, the Morris Minors, and the French cars too were in the market, the Ford Anglias. No, Ford Anglia was a British car. They were the in thing if you were working in government. In 63, at independence government, you were doing Woodley and such estates. Those were the up-end estates for Africans. Then you have Morris Minor and so on, like my sister had. Then you are there. Then the Japanese were coming and I said, this is a big market, people are just independent, middle class is coming up. Let's find a way of driving the British out of this market. And they came with a car called Toyota Corolla. It was costing 1,400 shillings new in town. You want to go back there those days? I remember very clearly. It was my brother-in-law's brother was a doctor, bought it. And they had an advert in the radio, Kenya Broadcasting Corporation, KBC then. Is it still KBC? It has changed names so many times. Is it back to KBC? I don't listen to it much. Anyway, so in the morning, as you were driving to work, there was this advertisement. Corolla comes from Toyota. From Toyota, there's always one for you. Within 2 years, the Japanese had driven the British out of this market completely. Nobody, very few people were dying for Morris Minor, whatnot, all these things. Corolla was the thing. And then came Corona, and then came Crown. Crown was like a Mercedes, so the Mercedes, of course, was resilient, but the Citroen, the one which really did like this, that one went. So if we are going to change men's health, it's like marketing. Drive it in every morning in radio and so on. Politely tell people what to do. So it is time to start social marketing around men's health. Are we able to start small and consider having a men's clinic in our large health facilities and social programs on radios and TVs that tell us what to do? Define a package of care for us men, put it out there and encourage us to come in and take it. This may be a good place to start today. Are we ready to have TV and radio programs that can educate our men and women in reproductive and health issues within the cultural context of our societies? I emphasize the cultural context because don't try to market something that abuses people culturally. They will be hostile. At the moment, some of these programs produced specifically within foreign market context are actually doing more harm than good. And let me add that they're actually doing more harm than good. Another area to explore would be in the line of social behavior changes. Men are known social beings and tend to congregate together in various areas, entertainment areas, sporting events, and so on. Think, for example, the male population currently in Stadium, Qatar right now, most of it is male. If you watch TV, perhaps design a mobile men's clinic that moves from event to event to promote men's health and provide a basic package of care at a nominal fee. That would make a difference. This is the same concept that has been used to increase screening of cervical cancer by having camps in marketplaces where women frequent, and has been proven quite successful. But that lady is sitting there, not looking at me now, but that's okay. We'll talk about that later. How about messaging that targets men? The messaging could be in form of men's health posters with specific displays of information related to men, mass messaging targeting men, social media campaigns, again, without necessarily offending their cultural values or our cultural values. As I end, I continue to lay emphasis on the role of public-private collaborations and how this can be used in advancing men's health. We need to consider the factors affecting their good health and equally invest in these. In general, simply the holistic management of health conditions that are most common or specific to men. Holistic. The sum total of all this will be a society of men and women that are physically, emotionally, and socially healthy. But these issues, but the issue of cost cannot be ignored as a barrier or an enabler for access to healthcare services. Cost can be both a barrier or an enabler, because nothing free. Remember the movie, nothing comes from nothing, nothing ever could. So here we are, standing here. What is the next word, part of it? I mean, you know, since I listened to that as a kid, and it's still in my mind, it shows you how effective it was. Nothing comes from nothing, very quietly. Sound of music. Nothing ever could. So here we are, standing here, doing what? I don't know. Aha, very good. This, of course, must include insurance. If profits is the central or key motive of healthcare delivery services in Africa, then we are in trouble. Then we are in real trouble. But if affordable insurance is the necessary buffer or the necessary route that can enable equitable access to healthcare by all healthcare seekers, then both the private and the public sectors will guarantee sustainable, affordable, and resilient healthcare systems in Africa. Let me repeat that, because the private and public sector must work together on this. If affordable insurance is either buffer or the enabler that can enable, sometimes you can have affordable insurance stated as that, but access to it becomes a barrier. Either because people are not aware, or bureaucracy, like NHIF, makes it so difficult that if an NHIF card, you go to the hospital, you need your thumb, you need what? You can stand there for many hours, and a man is very impatient. Say, oh, forget that. I'll go home and take some herbs. And maybe it's a disease that doesn't show up so quickly. It takes up herbs and you feel well. No, forget the hospital. So affordable health insurance by the private and public sector can both be a buffer or an enabler. Because if access is difficult, because it's impossible, then it exists merely in name. But it should be an enabler. If it's an enabler, then access to healthcare by all healthcare seekers, in both private and public sectors, will guarantee sustainable, affordable, and resilient healthcare systems in Africa. Asanteni sana, and Mungu awabariki.
Thank you very much. That song that Professor started for us ends this way. Somewhere in my youth or childhood, I must have done something good. So the men need to invest in preventive health in their youth before they get to 65. So at this point, I'd wish for us to have a brief photo shoot with our chief guest, with our opening ceremony speakers first. So I'll invite you, Your Excellency, if you can just join us for a photo shoot. Dr. Amit, Ms. Miriam, there's some steps. Our MD, Maluski Bacha, all our speakers first in the opening ceremony. Mr. Dagani, please. And then thereafter, we'll be joined by our sponsors. Okay. All right, please stay there and let us, you can move forward. The sponsors to join us, please. All our sponsors, Cosmos, Vitality, ECH Alliance, let's take a photo. NCI. Our sponsors today are National Cancer Institute of Kenya, AstraZeneca, ECH Alliance, with the Global Health Connector Partnership, Lumira, Cosmos, Smart Applications, KUTRRH, the Aga Khan Hospital, PS Kenya, Vitality Health International, Unique Research, UNICAF, North Star Alliance, Neurolabs, St. John's Ambulance that has an ambulance on standby in case of an emergency. Okay, join. Happy. Thank you very much. We will briefly continue with our opening ceremony.
Daniel.
right, we continue with our opening ceremony as our chief guest leaves us because he had another commitment. I will now wish to welcome Dr. Tedros Adhanom, the Director General of WHO, World Health Organization, to give us his address. It is a video address. Thank you.
Dear colleagues and friends, men in Africa have a life expectancy of 63 years. Dear colleagues and friends, men in Africa have a life expectancy of 63 years, the lowest of any region in the world. But change for the better is possible. Over the last 20 years, life expectancy for men in Africa has increased by 10 years. Still, men and boys still face many health challenges: harmful alcohol use, tobacco use, unhealthy diets, hesitancy to seek care, and either perpetrating or being the victims of violence. At the same time, access to quality essential health services remains lower in Africa than any other region. And every year, millions of Africans face catastrophic health spending. We must ensure that health systems serve to reduce inequalities rather than widen them. In Africa, more than half of health services are delivered by private providers, and the private sector has a critical role to play in both treatment and prevention. WHO is committed to working with private health providers as part of Africa's journey towards universal health coverage. And we're also committed to working with the private sector to address the underlying drivers of disease. Together, we can build a healthier, safer, and fairer future for the men of Africa and all the people of our continent. I thank you.
Thank you very much to WHO for sending us that address on men's health. I now wish to welcome on stage to give her remarks, Ms. Marianne Musangi. She is a board member at the National Cancer Institute of Kenya.
Good morning, everybody. I'm not sure what I'm supposed to say after all those doctors, and I definitely should have come before all of them to do this opening. So allow me to wear different hats this morning. I think the first hat would be one of a daughter, one of a caregiver, one of a board director of National Cancer Institute, and one of a business person. I'm in no way a doctor. I don't have grand titles. I didn't go to school for many, many, many years to learn all the things that most of you have done. However, I do believe that alone we can do so little. Together, we can do very much. My father died of cancer last year, June 2021. He was diagnosed with stage 4 of gallbladder cancer 5 years before that. And when we went to hospital, the diagnosis was bleak. We had not been given much time. Now, unfortunately, in Kenya, they didn't have the capability to assist him. We had to go outside of this country, outside of this continent, to seek assistance. Whereas they had given him 6 months to live, he lived on for 5 years, very strong. His name was Dr. Chris Kirubi. Thank you. So I sit on the National Cancer Institute, and I've been coerced to make this speech out of all the other directors that we have who are much more knowledgeable than I am. So, however, World Health Organization, as we have heard, has identified 6 elements that are critical in the effective functioning of any health system. These inclusive service delivery, health workforce, medical products and technologies, financing, health information, and leadership and governance. Health systems in Africa, however, face many challenges, as we know, across these 6 building blocks that impede the delivery of accessible, affordable, acceptable, and high quality health services, as we have heard His Excellency talk about this morning. This provides an opportunity for the private sector to contribute to the strengthening of the health systems through various modalities. I also sit on the board of Kenya Association of Manufacturers. I know we have some of the pharma teams in here, but manufacturing not involved in pharmaceuticals also play a very, very big part. I will say one of the organizations I run, which is called Hako Industries, was one of the first companies to create and start selling sanitizer literally 1 month after lockdown in this country. We provided to Kenyatta University, or the clinics, or the hospital, KEMSA, and we as a company are very proud of that and taking that opportunity to support our health services and our health systems is very important through collaboration. As a start, the private sector as a workplace has an opportunity to promote the general health and well-being of its employees, which contribute to the overall pool of a healthy population. This could be in the form of workplace wellness programs that create awareness on the importance of healthy lifestyles, screening for non-communicable diseases, and opportunities for early detection. They also have a role in enhancing occupational safety, which is essential in risk reduction of some of these diseases, such as cancers and other chronic conditions. The private sector should also consider itself a beneficiary of enhanced productivity that is to be found within a healthy population. This should be motivation enough for the private sector to invest in prevention programs that enhance universal healthcare coverage. Some of the opportunities that lie for private sector, of course, are service delivery through innovations. His Excellency was talking about innovation as he talked about technology this morning. Private sector could also be health providers, creating options for high quality, affordable services. We have great hospitals. We have people traveling all over from West Africa, Central Africa into this country to seek medical health care. The role of technology is great, and I know it's going to be discussed in great length today. Public-private partnerships in the establishment of the right infrastructure and equipment of healthcare services. Developed economies have leveraged increased trust and credibility between medical service providers and patients. They have put in place data sharing ecosystems that provide patient history digitally at the click of a button. In the fight against chronic ailments, that plight, both men and women, a simple digital file will save both costs and improve quality of care, since as it stands at the moment, repeated chronic medical tests that might not be affordable. We have working African ICT systems that interconnect healthcare facilities and players such as private medical insurance companies. And these can be leveraged to share information that can provide insight on interventions for men's health. We actually have these technologies in this country. This innovation does exist within this continent. Financing, it was discussed earlier as well. Most health systems have been unable to meet the Abuja Declaration targeting apportioning 15% of their budgets to healthcare financing. This opens up opportunities for investing in healthcare, either through direct financing or through PPP, public-private partnership opportunities. Private sector participation in health insurance to fill some of these financing gaps is also essential. Leadership and governance. The private sector has a role in shaping public policy, sharing lessons on efficiencies experienced in the private sector, improving governance through participation in boards, as myself, of hospitals and other health organizations. Participation in the NCI Kenya board would be an example to refer to, where we have a number of private sector directors sitting on these boards. Opportunities for partnerships as exemplified by the participation of the private sector in COVID-19 health systems. Access to medicines, health products, technologies, and building awareness. The role of the pharmaceutical sector in enhancing access to essential medicines and health products is critical. Opportunities for local manufacturing of health products and technologies. The other day I was talking to the head of KEMSA, and as CAM, we are looking to see how we can get more local companies to start on the innovation side and the manufacturing of medicines. So we do not have to go to other markets to start importing our medication. There is great opportunity in this area. Partnerships towards training of health workers, noting the huge gaps in some of the most essential health workers, leveraging on technology on enhancing and sharing of the limited health specialists through telemedicine. Personalized healthcare is a key component of managing any medical condition successfully. We have to make a deliberate investment in local apps to track our health and have this data accessible. It was not a joke when His Excellency was talking about the apps. With patient consent to medical practitioners to assist in coming up with accurate and personalized treatment plans. As we speak, we have local technology players that are championing this across Africa. Technology is indispensable. Partnerships are indispensable. As we think of healthcare policy advocacy, let us think through entrenching indigenous partnerships through technology to increase connectedness, accuracy, and faster delivery of healthcare services. And ladies and gentlemen, I will say that all of these are available within this continent. We do not have to look far. Let us be proud of ourselves and let us drive the awareness, let us drive the innovation, and let's look after our men. We need them as women. Thank you.
Thank you, Marianne. We like to talk about women as the pillars of our families and societies. But I keep reminding people that a house is not made of pillars alone. Our fathers are certainly the foundations of our homes, our families, and our society. Why we don't like talking about their health, I don't know. But we need a strong foundation and we need strong pillars. We cannot have one or the other by itself. Marianne, you also mentioned that we have these innovations on our continent. We have best practices that we can share with the world right here in the African continent. And so it gives me great pleasure to invite the CEO of one of the healthcare institutions in Kenya and Africa that is really setting the stage for NCD care, cancer care, men's health, women's health, Mr. Ahmed Dagane, the CEO of Kenyatta University Teaching, Research and Referral Hospital. Please take the stage.
Good morning, everyone. Morning again. Okay. It's a great pleasure to be here. My name is Ahmed Dagane, the CEO of Kenyatta University Teaching, Referral and Research Hospital. The acronym is KUTRRH. We have gotten comments that it's a long name. So as management and the board, we're considering shortening the name to KUH, Kenyatta University Hospital. So hopefully that will come to pass. So just to give you an introduction about this hospital, it's a level 6 hospital, state corporation under the Ministry of Health. We are neighbors to Kenyatta University. Kenyatta University is under the Ministry of Education. Most people don't know the distinction between the two. We're under the Ministry of Health. The university is under the Ministry of Education. And it's a relatively new hospital. We have recently been commissioned in September of 2020. We had accepted our first patient the September of 2019. So we had a dry run for 1 year, trying to establish that all the services are available, making sure that all the equipments are available and all that. And so we had been commissioned September of 2020. And since then, as you are aware, we have been hit by COVID in 2020, March. And that was when we were planning to commission the hospital. So we've delayed for about 6 to 7 months. But we've learned a lot from COVID, as you can imagine, because we have treated the largest population of COVID patients in the country. And that led to us accelerating in giving ICU. We have the largest ICU beds in the country now. We have 62 ICU beds as a hospital. So we have learned a lot from COVID, although it came with a lot of challenges, but also we had used that opportunity to improve the healthcare system in the country. So just a quick introduction about KUTRH. So since then, although we were designated as COVID, we have also been operationalizing other services slowly. And so we are not 100% operational now. There are some services that are not available, but we're almost there. We're at almost 90% now. COVID, besides COVID, oncology is our flagship project as a hospital. And right now we have influx of patients coming to the hospital, not just from this country, I'll be able to show you, but also from across the region. I'll be able to show you which countries that are sending patients to us. And then, of course, we have another session later where we'll be able to talk to you about some of the sophisticated equipments that we have. As a hospital, we are positioning ourselves to be the highly specialized hospital, not just in the country, but in the region. And so we have a stand at the end. Later on, we can have more conversation. So besides oncology, we have, of course, renal and all the other services that you can see on the screen. And then cardiology is another area of interest that is going to be another project that we envisage. We've recently opened our cath lab. And so we are going to also be running the cardiology services really well as our next flagship project. Our guest of honor had really talked about the health-seeking behaviors of men. And so I will not repeat that. And so as KUTRH, as you can see on the screen, because we're focusing on cancer, these are the numbers that we have seen. Of course, you can see more men have come in for surgical cases, 638 men, again, it's 534. While renal cases, you can see for male, we had seen 11,765 as compared to 7,741 at KUTRH. And then for esophageal cancer, you can see the numbers there. The numbers are higher than female. And then, of course, prostate cancer. You can see the steady growth of patients that we are seeing coming in for prostate cancer. We have a session later regarding cancer, and one of our colleagues, a director from our Integrated Molecular Imaging Center, will talk to you about prostate cancer and what we are doing as a hospital. Oh, sorry. I thought you were with me all. Okay. IT, I think they're working on it. Sorry about that. Oh, you're following. Okay. Okay, so our chief guest had talked to you about men having very poor health-seeking behaviors. When in our African setting, when an African man is going to a hospital, our mothers will tell us, you must be very sick for you to be going to a hospital. So I think that is a cultural norm, which now should change for the better, so that we are able to give access to men as well as our women. And then it is also very important for men to be seeking preventive health, because that, of course, will lead to early detection for various illness and risk factors. Okay, I think that's the other presentation for later, so it's the other one. Yeah, please. Okay, so I'll just continue. So for partnerships, it's very important to have a collaborative relationship with both private and public institutions. And as a hospital, as relatively as new as we are, we have established some very robust partners. Here with us today are representatives from University of Manchester. We have a collaborative efforts together. We'll be able to showcase the partnership, the power of partnerships in ensuring that the healthcare is accelerated, not just for men, but also for women. We'll show you what we're doing. But as a hospital, we have also relationships with our largest financier, NHIF, of course. We've also partnered with counties. We have invited 10 governors to our institution so that we can see how we are able to support the counties, of course, under the leadership of the Ministry of Health, that is setting up PET scans in those counties. And then what we are doing is, because we have the cyclotron machine, we are able to transport the consumables called isotopes to those counties, so that now we decentralize healthcare instead of clogging the system at KUTRH, where all patients will be coming to us. We need to take care of those patients in the counties, and that's what we're doing. Of course, other public and private institutions. Public, we have signed service level agreements with most of the major state corporations, TSC, the judiciary, KDF. Those are some of the institutions that we have signed service level agreements, and those patients or their clients are coming to us for treatment. And then, of course, we are a training, a research and innovation center. We have sought partnership through the community for residency training, research, and medical innovations. There are, of course, other regional partnerships that we have engaged when it comes to training. We have the College of Surgeons of East, Central, and Southern Africa, COSESCA, that we have partnered. Our own medical officers who are working with us doing residency fellowship training through that program. We also have East, Central, and Southern Africa College of Physicians. Our medical officers, again, who are our internal employees, have applied through our internal systems, and they are currently doing fellowship in internal medicine through that program. In the next few months, we're going to be rolling out College of Anesthesiologists of East, Central, and Southern Africa for our anesthetists who are medical officers who are interested in doing anesthesiology. For training and research, as I mentioned earlier, so University of Manchester and the Christie Hospital Foundation in the UK, we have a partnership going where we're doing knowledge and skills transfer through specialized training. Some of our staff have recently come back from the UK where they did some observership, and they'll be going back in the next month for a 6-month fellowships. We also have research for evidence-based treatments, including esophageal cancer, which will be showcased by the next speakers. And then I've mentioned all the slides are coming. Okay, so sorry about that. I will have seen you some very beautiful photographs of some of the state-of-the-art equipments that we have. But of course, I'll invite you to come over to KUTRH, where we can show you around. We have the latest technology in cancer, the CyberKnife, which is currently in the installation process. We'll be inviting His Excellency the President in the next month or two to launch that facility so that we can attract patients locally and also in the region. Our next speaker actually will be talking about the prostate cancer. We'll tell you the reason why we need the CyberKnife and what it does as far as taking care of cancer patients. It's now my pleasure to invite the two speakers who are with me, one from University of Manchester, Dr. Keith Brennan, who is the Vice Dean for Internalization, University of Manchester, as well as Professor George Njoroge, who is our Chief Scientific Advisor at KUTRH. Welcome, please.
Right. I should start by saying thank you very much to Ahmed for giving us the opportunity to speak here. And actually, it's also a real pleasure to be doing it with George, who's a good friend and partner, although he's quietly creeping off to the back door right now. Hope he comes back. Okay. So I was going to talk to you a little bit about where this collaboration came from, first of all. And it came from an opportunity that we had to listen to your previous president, Uhuru Kenyatta, at an African Investment Summit, which was held in January 2020 in London. It was just around the time that the UK was going through the departure from the EU, and he was talking about that process. And he sort of started by saying, I thought it was going to be a shame. It's a sad thing for the UK to be leaving the EU. But then he said, hang on a second, that means you can work again with Africa. And he pointed out very clearly to us that we had turned away from Africa, and it's time that we looked back. And actually, he was absolutely spot on. I thought about it when I was a child. Actually, I remember doing a lot with Africa. But we then went through a long period of time where we focused at Europe and didn't remember our friends from a time before. So I think he was absolutely spot on. It moved me, it moved my dean, and as a consequence, we came and we looked. In the scrum after the speech, we actually had an opportunity to talk to him for a few minutes. And he talked to us about KUTRRH, and I'm so glad you're going to shorten it to Kenyatta University Hospital. I won't get all my letters wrong. But he was talking about the centre, he was talking about their developing cancer, how they wanted to be a cancer specialist, and he invited us to come to Kenya. He actually invited us to come to Kenya immediately. We said, could we just have 2 weeks? And we were back in Kenya within 2 weeks, and we had the pleasure of meeting Olive, Magenda, Ahmed Daganye, George, Isaac, who sat quietly there, Alfred, who's around somewhere and I've lost. It was a wonderful conversation. It was a wonderful, it became very quickly a collaboration. And I remember Ahmed saying to me, coming to me quietly and said, is there any way that we can turn this into a comprehensive cancer center? And it actually was Ahmed that asked me that question. And I said, well, we can have a look at that. We can think about it. And actually, it was very clear that there's 3 things that you absolutely have to do to make a comprehensive cancer center. One is thinking about training. And you've heard Ahmed just talk about the wonderful training that they're doing at the hospital. We're talking about the opportunities to get training within the Christie Hospital, which is one of the best in the world. That was one aspect. The second aspect is thinking about research. I'll let George talk much more about that, but that opportunity to do the research, to understand cancers in a Kenyan and East African environment. For too long, we've looked at cancers in a North American and European environment, and the truth of the matter is we have to look at it here. And to give you an idea, George and colleagues directed us to esophageal cancer, and we're like, oh yeah, that's fine. Adenocarcinoma of the esophagus. And then George quietly tapped us on the elbow and said, no, squamous cell carcinoma of the esophagus. And it's actually so important to hear it and hear it from you and think about it in this environment. So it's absolute pleasure for us to be involved. The other thing is so much we can learn back from working with you. Amit mentioned it in the beginning, what we can learn back into the UK. We have a large diaspora population, and we treat them wrong. We can learn, and we can actually make a difference there. The last element is then thinking about clinical service, and Ahmed's actually again mentioned this. This is about not it just being KUTRRH. It's a fantastic hospital. It blew me away going in there. It is really impressive. My colleague Mahesh actually got in, he's an ICU, he's an intensive care consultant. We went into your intensive care unit. I could see Mahesh getting his CV out, polishing it, and wondering whether he could stay. I know he's been back and he's coming again, and he'll love to be there. But that clinical service, not just being in KU, it needs to be across the country and reaching out to the country and letting people to have that opportunity to get service locally. And actually, I think it's great that we've had His Excellency from Kisumu here today, because that actually really represents that. So we've worked with Ahmed around the Molecular Imaging Centre. We'll hear more numbers about who's been coming to see that. We have the esophageal cancer research ongoing. We've talked about a one-stop breast cancer care centre where a woman can come in the morning and know their diagnosis by the evening. It's be such a game changer, and it's amazing to see that it's been set up. Actually, that came from a visit to the Nightingale Centre in February, and I cannot believe that you've got it up, running and open, and we're only in November. It's incredible. We've also talked about what we can do more around breast cancer screening to increase the rates of screening amongst women. We've been talking a lot about men's health, but actually there's still a need there to look at that. We're discussing cervical cancer. We're discussing prostate cancer as well. Clearly, that's much more important for today. But I wanted to finish on one last thing, and I've probably robbed far too much time. I apologize. The WHO recognized that there will be a significant deficit in healthcare workers by 2030. 40% of that deficit will be in Africa. It is actually the only continent where that deficit is increasing. You actually have less of a deficit at the moment, and by 2030, it will be bigger. So the one thing that we've been talking about very much this week with colleagues from the Lake region is about the possibility of establishing a centre of excellence for healthcare, education and training to make that next generation of healthcare workers that will be needed to be able to cope with the rising incidence of non-communicable diseases. So not just cancer, cardiovascular disease, stroke, mental health, etc. It's just going to be an exciting adventure, I think. And one thing that I absolutely love, we're from Manchester, we're not London. We're in the regions. The whole idea that this could be out in the Lake region actually it appeals to us massively in that sense. I should say thank you to Ahmed for letting me give this time.
Professor George Njoroge. Good morning. Thank you, Keith, for that introductory speech. It's very exciting. This has been a wonderful, wonderful collaboration between KUTRH, and not only KUTRH, it's even the other institutions in Kenya. Wonderful collaboration in the cancer area and those other areas that you have heard about. So my name, as I said, is Professor Njoroge. I've been working in drug discovery area for the last 30 years. Came up with the first antiviral HCV protease inhibitor from Merck Sharp and Dohme, and retired from Merck Sharp and Dohme in 2019, and I have been helping the KUTRH as their chief scientific advisor, as well as KEMRI as their research and innovation. So what happened, I want to talk a little bit about collaboration, because this is the way the collaboration worked. It was very, very interesting when the University of Manchester came to us and they said, we are very, very interested in working with Kenya, and we realized we need this union between Britain and Kenya. And we started looking for the projects that could move very, very fast. And the first one we thought about, let's get into the cancer area. And it was very interesting. We looked at various cancers and had to figure out where do we start, because we wanted to look at many things. But we looked at a number of them, looked at breast cancer, which a lot of advances have been made in breast cancer. And one thing stuck out. If you look at breast cancer, the prevalence or the incidence is about 48%, but the mortality is about 17%. If you look something like esophageal cancer, the incidence is about 17.8, and the mortality is 17.8. That means if you are diagnosed with esophageal cancer, the chance that you succumb to that disease is about 99.9%. That was very scary. So we put our minds together, put a proposal. Why is this happening? And between KUTLH and other institutions that I'm going to mention, we looked at it carefully and found out it's because the presentation. People or patients present themselves at a late stage, stage 3 and stage 4, because when they go to the hospitals at stage 1 and stage 2, either they have a cough or a heartburn, and they're given something to suppress the cough, and they're told to go home. When they come back, they are at a very advanced stage. So how can we tilt this balance from stage 3 and 4 to stage 1 and 2? And we came up with a very important method to use, whereby we're going to be using mobile clinics, endoscopy, having training the healthcare workers, the first ones that see the patients, providing them with the endoscopic equipment, so that when they find some lesion or they think there is a possibility the individual might be suffering from esophageal cancer, they can recommend that they have some endoscopy done. And that's what we have already started. We wrote this proposal, submitted it, and I think here there were many proposals that were submitted from all over the world. And what came out is our proposal came out to the top, and we were given about $500 million shillings, and we are told that is just starting money. If we can demonstrate that our hypothesis is working, then they are ready to even give us, to provide us with more funds, 1.5 billion shillings. So we are working very hard to make sure that the outcome from this project works. Now we are working with various counties. We are calling what we are working with is what we call the hub and spoke model, because this is not just like a KU effort, it's a national effort. So we're going to be working, KU will be the hub, and then we have Kisii, Nakuru, and Nyeri, Kiambu, 5 counties to start with. And then we're going to be sending this endoscopy mobile clinics to all these facilities. But more interestingly, thank you. More interestingly, we should all realize that cancer is a genetic disease. And we really have to understand the risk factors. We hear anecdotally that it's because of people in Kiambu are drinking hot tea, people in Bogoria are drinking music, and everybody will tell you why there's cancer in particular area. So one of the aims is to look for those risk factors. And by looking for those risk factors, we understand since cancer is a genetic disease, we need to find some biomarkers. In Western world now, if a woman has a cancer of the breast cancer, you are not just given a general chemo. They will first of all check you whether you are HER2 positive, and if then they can give you Herceptin. And so that's where we want to be. We want to now, on our third aim, to start identifying what are the biomarkers. Can you go to a doctor and they take your blood, just like they do for kidney, where they check for your creatinine and see whether your kidney is functioning properly? Can we get some biomarkers or some genetic markers that will demonstrate to us where this cancer is coming from? That's a very advanced part, but I think it will be very important, not only for us, but for the whole world. So we will keep on doing that, and we will be going in the right place. Thank you very much.
Thank you, Professor Njoroge, and thank you, Dr. Keith Brennan. So these partnerships that we had showcased here has actually benefited patients, not just from Kenya, but also from Ethiopia, Uganda, Congo, Somalia, Rwanda, Tanzania, Sierra Leone, Ghana, Nigeria, Burundi, and South Sudan. Of course, we have treated patients out of Africa from the UK, India, Pakistan, and China so far. We could not show you the slides, but there was also another slide because these patients that have been treated at KUTRH, particularly in our integrated molecular imaging center, would have gone to India or South Africa for treatment. And once you compute that, there was a slide that I'll have shown you. It's billions of Kenya shillings that has been saved. Otherwise, those patients could have gone. And so we're trying a level best as a new establishment to make sure that those patients are retained here and that we also bring medical tourism to our country. Thank you very much.
Thank you. Indeed, a Pan-African healthcare provider right here in Kenya. Our last speaker for our opening ceremony, certainly not the least, is Professor Giulio Rakotonirina. He is addressing us online, and he's the Director of Health and Humanitarian Affairs at the African Union Commission. Welcome to give your address, Professor Giulio.
Thank you so much, and I'd like to ask you before, if are you hearing me correctly? Hello? Can you confirm that you are hearing me now?
Yes, we can hear you. It's gone.
Okay. Excellencies, distinguished guests, ladies and gentlemen, all protocol observed, it is an honor for me to join the 7th edition of Africa Health Business Symposium and discuss Africa Men's Health. Let me take this opportunity and thank Africa Health Business for extending invitation to the African Union Commission. The topic before us, Africa Men's Health, is very important. Moreover, it justifies to discuss men's health after the launch in Addis Ababa only 2 weeks ago of the Coalition for Women Health. I think it is important we keep track of the two sides by side. Sex and gender have been shown to influence health literacy, health-seeking behavior, and health outcomes. When speaking of gender equality in all spheres of life, including but not limited to access to healthcare and services, we oftentimes tend to have a skewed approach toward women. Yet, men did not benefit from improved health status owing to the new technology, innovation, and science that have translated into improved life expectancy compared to women. In fact, women live longer than men globally and in Africa as well. I'm not jealous of that, but I truly believe that the society is much better off when men and women can hang around the same longer, enjoying the same healthy life years. Ladies and gentlemen, reflecting on the journey of Western countries regarding health outcome and status over time, we notice that as nations develop, non-communicable diseases tend to become of greater concern. And this is already happening in the Africa region as well. The same way, and because of epidemiologic transition, our continental and regional policies are already reflective of non-communicable disease as strategic areas of interventions. It is also high time we question these trends in our continent to adequately address African men's health. I will not go back to the indicators that were announced by the speakers before me, but I just want to emphasize 2 points. First, trauma, including traffic accidents, accidents of war, and physical violence, affect particularly men. Second, men should be making better lifestyle choices that would be the main causes of non-communicable disease. Ladies and gentlemen, we know for sure that women's health is the one that has been the long-standing global health priority. And of course, we have to continue on. But this brings me to question our health policies and programs, our health systems, organizations, and to which extent do they also respond to men's health needs. The objective is not to create competitions, but to develop an environment of good co-evolution and right equity of health system, both for women and men. In this regard, I'd like to commend Africa Health Business for taking bold steps to keep Africa men's health high on health and broader development agenda. Ladies and gentlemen, on my part, I'd like to assure you that the African Union policy frameworks on health allow room for equal planning, programming, and provision of healthcare and services to women and men. However, having the right policy frameworks in one thing and their effective implementation is another thing. Therefore, I believe advocacy for an increased knowledge and ownership of Africa men's health as a health priority is very important. I therefore would like to call all the participants of this meeting to be the advocates that will take Africa men's health to the next level. The Africa Union Commission remains open for partnership and will continue to do the needful for betterment of African men and women's health. I wish you fruitful deliberations. I thank you so much.
Thank you, Professor Julio. We were in Addis Ababa on 9th of November launching the Coalition for Women's Health in Africa. He was one of our chief guests. So we're really honored to have you, Professor, speaking at Men's Health. So you have earned your tea break. As a reminder, our next sessions are about preventive and promotive health, NCDs, cancer, and sexual and reproductive health for men. But for now, do enjoy your tea break and networking. Take selfies with each other, and let's convene here at exactly 11:15. Yeah, thank you.